Assalamu alaikum wa rahmatullahi wa barakatuh. I hope you have discussed postnatal care by now. The topic for discussion today is the intranatal care and neonatal care. Now, at the start, let me tell you that we are not going to have a detailed discussion on intranatal care or neonatal care. As you know, these are purviews of obstetrics and pediatrics, respectively. Rather, what we shall be discussing is only an outline of intranatal care and neonatal care. And we have specific objectives for this session, and I hope that by the end of this session you will be able to enumerate the objectives of intranatal care, explain what's meant by safe and clean delivery, and list the 6 cleans for a clean and safe birth, and list the danger signals at the time of delivery, enumerate the objectives of neonatal care, explain what's meant by essential newborn care or essential care of the newborn, and list important neonatal complications and discuss their management, and list the danger signs of the newborn and enumerate at-risk newborns. So we have I have basically set up very specific objectives for this session because I didn't want to deviate more to the neonatology subject or to the obstetrics as such. The focus is only on the community medicine aspects of intranatal and neonatal care. So we'll be more focused on prevention rather than treatment of different complications, etc. So the objectives of intranatal care. So the ultimate goal is to have a safe delivery for the mother and have a healthy baby at the end of the delivery. Therefore, the specific objectives are to promote clean and safe delivery. We'll be deliberating on clean and safe delivery. Prevent infections and other complications in both mother and newborn. Recognize the danger signals and be ready to manage them. As I said, we are more focused on the community medicine aspects. So rather than saying what a pediatrician or what an obstetrician does at a higher center, we'll be focusing on what should a health worker be doing at maybe a sub-center or a medical officer be doing at a primary health care. Then their job would be to recognize danger signals and be ready to manage them and know when to refer mothers or newborns to higher centers for further management. Then they need to ensure immediate and essential care of the newborn at birth. And the ultimate aim, as I said, is to reduce death rates, the infant mortality rate and the maternal mortality ratio. So what's a clean and safe delivery? So safety is would mean to prevent injuries. We do not want any injuries to the mother during delivery. Okay, so specifically the perineal injuries. Therefore, if required, an episiotomy can be done and should be done, and this should be done by a trained person, not by a midwife. This is to be done by a doctor at a higher center, maybe, or maybe even in a primary health care. Then clean delivery means we want to prevent any infections. Okay, so how can we ensure this part, the clean delivery and to prevent infections, is essentially more important part of the safe and clean delivery. That's why you would have heard about the traditional 6 cleans that the World Health Organization advocates. So these 6 cleans are the clean hands. The hands of the person who conducts the delivery should be clean. Clean mother. The mother should be clean. Essentially, the perineal area of the mother should be clean. The surface on which the delivery is to be conducted should be clean. You would see that if you have heard about something known as a disposable delivery kit, so that's a sterile delivery kit which used to be there at the subcenters wherein deliveries were conducted. So the ANM or the traditional birth attendant, she used to be given that one kit that ensures a clean delivery if the delivery is to be conducted at home. So it contains soap so that she can wash her hands and ensure that her hands are clean. Then it may contain a rubber sheet, which is sterile rubber sheet, which can be put on the bed on which the delivery is to take place, so that the delivery surface is clean. Okay. Then it will also have a sterile blade for cutting the cord, so that's clean cord cutting. Fourth, then there is a tie which is also sterile. That's the fifth, clean cord tying. And then the cord, the umbilical cord, at the end of the delivery, it should be left dry. Okay, nothing should be applied on the cord. It should be dry cord so that there are no infections of the umbilical cord as such. So these are the 6 cleans: the clean hands, let's repeat it, the clean hands, the clean mother, clean delivery surface, clean cord cutting, clean cord tying, and clean cord care. So what will be the result of observing those 6 cleans? There are three very important infections which we will prevent if we adhere to those 6 cleans. One is puerperal sepsis, the neonatal tetanus, and ophthalmia neonatorum. Okay, so if we observe the 6 cleans, we are ensuring a clean delivery, and we are ensuring that there are no infections in the mother and there are no post-neonatal infection. There are no infections in the neonatal period in the infant, the neonate. Okay, so this way we ensure that the first 2 objectives of intranatal care are satisfied. That's the clean and safe delivery and the prevention of infections. Okay, this I have given a list of the disposable delivery kit, the contents of the disposable delivery kit, because sometimes some examiners might ask, what's a DDK, the disposable delivery kit, and what are the contents of the disposable delivery kit, and also because it's mentioned in some of your textbooks. So some of you who have the habit, those of you who have the habit of reading, might have gone through this list in one of the textbooks of community medicine that people usually read. Okay, the danger signals at the time of delivery. So as I said, that the health worker or the medical officer at the primary health center should know about the different danger signals, so that if something like this happens, then this is the time for extra care or maybe a referral of the patient to a higher center wherein more such facilities for the management of such cases are available. So these include that the mother has the pains are good, but the labor is not progressing, or the labor is not progressing at all. Okay, so it may be an obstetric labor, it may be a prolonged labor, or if there is bleeding or convulsions or high temperature, or after the delivery if there is non-separation of placenta, or even if the mother collapses. So these are some of the danger signs, and the health workers or the medical officers, they need to be cautious and they need to keep an eye on those maternal signals. Okay. Then the fetal signals are meconium stained liquor amni is sort of an emergency. Okay. And then regular monitoring of the fetal heart rate. If the fetal heart rate is too slow or too fast, too slow, traditionally less than 120 beats per minute or more than 160 beats per minute, this is a red signal. Okay, so this is a danger signal. Fine. Then if there is a prolapse of the umbilical cord or hand, these are the 3 danger signals, fetal danger signals. Now, how do we ensure that the delivery takes place safely and that the health worker would ensure that there are no danger signals? One way of doing this is to train the health worker to use a graph like this, which I hope all of you can now recognize that this is what we call as a pathograph. Okay, so if the health worker is trained to use the pathograph, this will help her or him to basically know that something is wrong and I need to take some extra take some extra precautions, or I need to refer the patient to a higher center. Okay, let's come to the neonatal care. Okay, so The objectives of neonatal care, I have enlisted the objectives of neonatal care. The first is immediate and essential care of the newborn. Now, this is something which can save the life of a neonate. Okay. Then the second is prevent neonatal complications like infections, hypothermia, and birth asphyxia. Next is educate the mother about the danger signs of the newborn, and detect at-risk newborns and provide them special care, promote growth and development, and the ultimate aim would be to reduce perinatal and early neonatal mortality. Okay. So I hope you remember that perinatal period and the early neonatal period. Okay, so the neonatal period is for 28 days, the early neonatal period is the first 7 days of life, and the perinatal is around natal, as the first 7 days of life, but it also includes the periods of pregnancy as well. Okay, from 28 weeks of gestation up to birth of the baby. Now let's talk about the neonatal care and why basically the neonatal care is so important. Okay, see, this over here is what we call as the 2/3 rule. Okay, so this says that the 2/3 of all the mortality that occurs in the first year of life, 2/3 of all the deaths that occur in the first year of life occur in the first 4 weeks. Okay, so if there are, say for example, 100 infant deaths, that's 100 deaths during the first year of life. Two-thirds of them, or 66.7% of them, would take place in the first 1 month only, and 2/3 of the neonatal mortality occurs in the early neonatal period, the first 7 days of life, the first week, and 2/3 of the early neonatal deaths, 2/3 of the early neonatal deaths occur within the first 24 to 48 hours of birth. So this can tell you that how important the first few hours or the first few days of life are, and that's why we need to act immediately, and it's essential. Now, what do we mean by essential newborn care or essential care of the newborn? As I said, that if you have gone through the objectives of the intranatal care, of the neonatal care, you would have noticed we are focusing on hypothermia, prevention of infections. Fine. Okay, so the essential care of the newborn basically revolves around this. The immediate is the body temperature of the child should stay normal, and then the child should be able to breathe properly. Usually what happens is that if the delivery has taken place in a clean environment, then we ensure that there are no infections either in the mother or in the newborn baby. Fine. Hypothermia is a primary concern. Therefore, it's important that the environment or the room in which the delivery is taking place, the temperature of the room should be warm. Okay, and then we should use a clean and dry towel or cloth, and then we can basically keep the baby on mother's chest and abdomen between the breasts, something we call as, what do we call that as? It's a skin-to-skin contact of the mother and the child. Okay, so you might have heard about rooming in, keeping the mother and the baby in the same room, bedding in, keeping the mother and baby on the same bed, and especially for those babies who are born with a low birth weight, the kangaroo mother care. Fine. These are basically done to make sure that the child does not develop hypothermia, and then there is a social bonding between the child and the newborn and the mother. Okay. Assess the baby's breathing while drying. So as soon as the baby is born, what usually happens is that most of the children, as you know, they will breathe spontaneously immediately after birth. But in case there is a delay of say around 15 to 20 seconds, then we say that there is a birth asphyxia, and in that case we need to act immediately. Okay, what we can do is that we can ensure that the respiratory passage is patent. We may use a mucus extractor, or sometimes what we see that is that even when we have ensured that the respiratory passage is patent, there is no mucus, etc., the child does not breathe. So what we can do is that we can flick the soles of the child with our fingers, and sometimes there may be a need for resuscitation of the baby. So it's essential to see that the baby is the baby cries and is breathing immediately after birth. The baby should be kept dry and warm. Okay. Then the next is cord care. So the clamp and cut the umbilical cord when pulsation stops or in 1 to 3 minutes. This is known as the delayed cord clamping, and it's said that a delayed cord clamping may actually prevent anemia in the mother. There should be a skin-to-skin care, skin-to-skin contact of the mother and the baby. It ensures warmth to the baby, and it gives improves a psychological bonding between the mother and the child. Cover the baby's head with a cap. Again, these are all are steps to ensure that there is no hypothermia. Encourage the initiation of breastfeeding as soon as possible. As soon as possible, irrespective of the type of delivery, as soon as possible, ensure that the breastfeeding is initiated. And there should be no prelacteal feeds that should be given to the baby, and the baby should not be artificially fed. Administer injection vitamin K intramuscularly to baby according to weight. Usually it's around 1 milligram of vitamin K that's given intramuscularly to the baby if it weighs more than 1 kilogram. So what are the benefits of essential newborn care? So, what we need to do is that we need to ensure that the baby is warm, okay, that the baby does not suffer from any infection, the baby is given mother's milk as soon as possible, the baby is breathing normally, and we need to prevent neonatal anemia, as I said, by ensuring a delayed cord clamping. So this is a chart about the injection vitamin K for the newborn. You can go through it if you need. Now, you might have heard about Apgar score, APGAR, Apgar score. Okay, it's a simple method of quickly assessing the health and vital signs of a newborn baby after delivery. Okay, it's A, which stands for appearance, P for pulse, G for grimace, A for activity, and R for respiration. Fine. So there are 5 domains. These are scored from 0, 1, and 2, so that the minimum score can be 0 and the maximum score can be 10. A score of 0 to 3, it's a critically low score. It might need an ICU care for the neonate. 4 or 6 is definitely beyond normal. The child needs special care, and Apgar scores of 7 or more are considered normal. So these are the, as I said, A is for activity, which we see by muscle tone. P is for pulse, which we can see the heart rate or the pulse rate of the baby. G is for grimace, reflex irritability. A is for appearance or the skin color, and R is for respiration. Okay, so you can see this chart is there in your books as well. So just remember that score of 7 and above is normal, and if there is a score below 7, then something is wrong, and the baby definitely needs special care, maybe in an intensive care setup. Okay, so we did discuss about 3 neonatal complications. I just want you to remember again that these are the 3 most important complications. There are many other diseases and many other complications that might occur either immediately after birth or maybe during the neonatal period. Now remember, neonatal infections, okay? This includes septicemia, this may include acute respiratory infections, this may include diarrheas, and as you know, acute respiratory infections, diarrheas, etc. This usually occur not very immediately after birth, but maybe after a few days. Hypothermia is something which needs to be taken care immediately after birth. Birth asphyxia is something which needs to be taken care of immediately after birth. Now, this is the thermal range in the newborn. The normal temperature is between 36.5 to 37.5 degrees centigrade. Okay, what are the danger signs of the newborn? Now, we need to educate the mother about the danger signs of the newborn, that if something like this happens, then you need to report to us. You need to report immediately to the health worker or to the doctor if you see any of those danger signs in the newborn. The refusal of feeds, increased drowsiness, cold touch, difficult or rapid breathing, convulsions, persistent vomiting, jaundice at birth, and blue discoloration or blue coloration of the extremities. So the health workers should be aware of those danger signs. The medical officer at the primary health center should be aware of those danger signs, as well as we should educate the mothers or the caregivers about those danger signs, that if the baby develops any of those danger signs, you need to report immediately to the doctor. So lastly, what we are going to discuss is the at-risk newborns. So herein I have given a list of at-risk newborns. It's there in your book. So remember that all those babies, they need special care. They don't need usual care. They need special care. Fine. Low birth weight babies, a baby having birth asphyxia, birth injury, loss of mother's milk, born within 2 years of previous birth, loss of previous siblings, illegitimacy, okay? Birth order of 5 or more. Now, what I need you to think is that why are these newborns basically at risk? Why is loss of mother's milk a risk for the baby? Why is illegitimacy a risk for the baby? Okay. Now, the others you can see with congenital any congenital defect or disease. If the baby is born to a hypothyroid mother, if the mother was not immunized during pregnancy, if there is jaundice at birth, if the mother is infected with any of those infections, or if the Apgar score is less than 7, basically. If the Apgar score is less than 7, the baby is at risk. If it's less than 5, then the risk is very high. Okay. So I hope that we had I hope that I was able to give a good overview or an outline of the intranatal and neonatal care, and that's all for today. Thank you.